So let us continue with Nash therapeutics study streak, and there is one big remedy which we wish to undertake today, which is in continuation with what Dr. Nash tells us in his Leaders in Homeopathic Therapeutics, and that is Argentum nitricum. So, what does the first line of Dr. Nash Therapeutics say about Argentum nitricum? He quotes authors directly who are verified, who are source book for all of us in today's age. And he tells us we think of this remedy on seeing a withered and dried up person made so by the disease. And this is especially in cases of children. He looks like a withered old man. So this gives a clue to not just understand the remedy, but how should a homeopath be in taking the case. And even before the case is taken, he should know that the appearance of the patient should guide to an idea of how should the person be at that age and how he appears to be at that age. It doesn't give us an idea that we should directly jump onto the remedies, because there are a lot of remedies which look old, especially children who are brought to you, or they look like they are quite senior but they are of an underage. At least you should be able to understand that your analytical mind is observing the appearance of the child and not concluding anything. That is the best part of understanding all these stalwarts. So glad to see Vital Healing, Monica, and its tuberculinum. Hope you are like tuberculinum in gaining lot of knowledge from different sources. If we adopt a particular name, we should follow it to the true essence. So good to see some usual people joining and some new people also joining on Instagram and YouTube also. So we are over here and we are seeing that remedy Argentum nitricum from Nash Therapeutics, and he tells us that this remedy affects the mind like gold. There is lot of hypochondriasis. And then again he quotes, after quoting Gunsi for the first sentence, now he quotes Herring. And he tells us that Herring tells that the sight of high houses makes him dizzy and causes him to stagger. It seemed that the houses on both the sides would approach and crush him. This is exactly what the nitrate state is if you study the latest literature. So you have to go to the old literature and new literature, old literature, new literature. Once you understand how to, compare both the spectrums, you will master homeopathy. Because what the stalwarts of 1800s, 1900s, and uh, of that age saw, and what the current stalwarts see, will be a gradual evolution of homeopathy. And if you understand this gradual evolution of homeopathy, you will grow and evolve as a better homeopath. So, Argentum nitricum is a remedy which is impulsive, must walk very fast, always hurried. And he gives another remedy in brackets, which is Lilium tigrinum. So, wherever we find that Argentum nitricum is the remedy to be thought for this patient, we should give a thought to Lilium tigrinum. And then he also quotes another symptom, apprehension when ready to go for church or opera, it brings on diarrhea, and the remedy, another remedy which we can think of is gelsemium. So all the cases where we are giving gelsemium, we should think of Argentum nitricum also and differentiate, because some symptoms will be very much similar and you will have to differentiate using physical generals: thirst, likes, dislikes, sleep, stools, urine. perspiration, thermals. Because on the mind aspect, both the remedies will be found in the same rubric, which is anticipation, apprehension, or anticipation before an event. But what will be the differentiating factor for the remedy? Not another mind rubric, which is very rarely the case, but you will be able to differentiate very easily from the physical generals. So what Dr. Nash tells us further is that hurried feeling of urgentum nitricum and lilium tigrinum have occurred mostly in uterine troubles, while the diarrhea on excitement seems to be mostly upon a nervous condition. And then he quotes something which is valuable, and this is what the current masters are doing. Whatever senior homeopaths you see, they are all following this method. And what is that method? Unless the indications point strongly to one remedy, you should first try the vegetable first, which is Lilium tigrinum. And the minerals are generally longer and deeper in action and would be preferable in more chronic the case. So you will have a patient who will tell you that I am having exams tomorrow. It's an exam season in Maharashtra. I don't know about the other states. And I am having a lot of diarrhea. If we ask them, is it in every examination that you have this? And he tells yes, urgent and matricum is the case. And if it is only the first scenario, then maybe gelsimum is the scenario. And if the person is hurried, you can also add a dash of Lilium tigrinum to your thought and differentiate and give the most similar remedy. So going further, Dr. Nash then goes on to describe the different parts of where the argentum nitricum is bound to act. The first thing is the head. Hemicrania, feeling of expansion and better by tying himself or that part up. And this he tells very closely it is there in Aeschylus. I wonder how many homeopaths would be giving Aeschylus as a remedy for headache or throat complaints, but it's very rare to find. So you should open up your avenues of a remedies prescription on different areas. Vertigo in argentum nitricum is always there with buzzing in the ears, and there will also be concomitant symptom of general debility and trembling. So we all know that Dr. Bonigosen gave us the idea of concomitant symptoms. And you will find that in most cases you will be able to elicit concomitant symptom if you know how to elicit. Otherwise, you are tying yourself up to the comfort zone and the medicines and the certain typecast rubrics and giving the same usual prescriptions forever, which is very, very, very limiting yourself and your prescriptions. Going further, Dr. Nash tells us that he cannot walk with the eyes closed. Sight of high houses makes him dizzy. Another remedy is gelsemium. And he tells us that if it is a complaint which has just begun for a few minutes or few hours ago, give gelsemium. If it is not helping, or if the patient has a chronic issue, again think of argentum nitricum in the end. So in this way you can differentiate one remedy from the other, and Dr. Nash is all about differentiating one remedy from the other, comparing one remedy from the other, taking some inspirational cases from his own practice from different homeopaths, and serve it in the form of a materia medica, in the form of therapeutics. And this is an inspiration for all homeopaths. We are learning all new methods, new techniques, new rubrics, but we are forgetting the old stalwarts. So go back to your source books and you will find real gems for practice. Argentum nitricum is given for eye complaints by Dr. Nash, that there is intense chemosis, strangulated vessels, most profuse purulent discharge. Even the cornea begins to get hazy, looking as if through a slough or some dirt is there. Now he also tells us that after this symptom, he tells us that subjective symptoms are almost none. They are non-existent. But everything is objective for the physician to see and prescribe. And he tells us that the same situation is present in Apis mellifica and the stocks. You will have to differentiate using modalities or some other characteristic symptoms. So, further, he quotes Norton, which is a very good book on ophthalmology, where he tells us that I do not believe in the cauterization, which used to be done a lot of times for such patients in the past, except if it is gonorrheal form of purulent conjunctivitis. All other cases, argentum nitricum or apis or rustox has worked for Norton or for Dr. Nash. Going further, Dr. Nash tells us that ophthalmia neonatorum, children having the eye complaints, Merck sol is given by him. And for blepharitis, he thinks of graphitis, staphysaglia, and borax. And he gives a description in short about how borax is having a peculiar tongue which you can find out easily and prescribe borax. So you should not limit yourself to one remedy or a single method or single way of thinking, but open up your horizons. Going further, Dr. Nash tells us that there is this kind of gastric symptom which is there in argentum nitricum very often, which is irresistible desire for sugar, and fluids go right through him. If you understand this, you will understand the symptom from the patient, which is as soon as I drink water, I need to rush to the washroom. As soon as I eat food, I need to go use the loo. And most complaints of the gastric spear are accompanied by belching. Lot of people will come and tell you that I have lot of gas, distension, flatulence. If you give a thought to carbovage, lycopodium, these are cognates of argentum nitricum. And you will see that usual prescriptions, Dr. Nash has also mentioned that carbovate, china, or lyco are given to all such cases where the stomach is full and the wind goes out with lot of noise and violence. But argentum nitricum will solve the case if there is craving for sugar or urging for stool after eating or drinking immediately. So there are few peculiar symptoms which Dr. Nash tells he's verifying in his practice also and quoting those symptoms in all the remedies. Green mucus with chopped spinach like flakes and stool turning green in the diaper. Stool expelled with much spluttering. Stool is shreddy, red, green mucolymph and epithelial substance. So you get your patient's stools examined if there is a chronic problem, and you will find that there is kind of these lymphs and epithelial substances or some shreddy mucuses. You can then think of argentum nitricum very strongly, especially in long standing cases of Crohn's disease, IHDs, IBS symptoms. And he gives a differential between calcarea phos and argentum nitricum, especially in cases of children where there is a lot of confusion whether one remedy is to be given and not the other. And he claims very strongly that if it is a case with bony troubles, think of calcarea phos. If it is a case only suited or only giving out the symptoms from the gastric spear, think of argentum nitricum. Then he quotes the symptoms of the throat, and he tells that there is thick tenacious mucus in the throat obliging him to hawk and causing slight hoarseness. So you will see many patients do come to you, they will do like this. This is nothing but hawking. Argentum nitricum and metallicum, both the argentums are very good for these type of patients, especially they are singers or they feel that something is stuck up in the throat, just like the remedies nitric acid, heparsulf and dolichos, and they feel that something is sticking in the throat when they swallow and they need to clear the throat often. If you go to the rubric in the repertory, hog disposition to or hog ineffectual efforts to constant, you will find argentum, one of the compounds of argentum, if not both. In the bigger rubric, you will find both the remedies elsewhere. And further down the line, Dr. Nash tells us about the back pain of argentum nitricum, which is relieved when standing or walking. But as soon as he rises from the seat, there is a pain. This is also there in thuja. This is also there in sulfur. And Dr. Nash tells us that he has often given sulfur or causticum in such cases where the pain is aggravated in the back on rising from sitting position. But also remember argentum nitricum. So you'll have to differentiate again by following a protocol of understanding the physical generals or physical particulars or modalities of the patient. And last but not the least, he comes to the nervous system of action of argentum nitricum, where there is paraplegia from debilitating causes or paralysis after some severe prolonged throat complaints, and argentum nitricum can be thought. If there is epilepsy or convulsions in certain types of patients, you will find that few days before the attack, you will find pupils are dilated, and then there is restlessness after the attack. So many times we get patients of epilepsy, we get patients of these long-standing nervous complaints. We should try to find out the onset, duration, progress of the complaints, and what happens before the complaint begins, during the complaints, and after it. Only then you will be able to individualize the case. Otherwise, you are taking a routine case which is going to fail in your practice. Last but not the least, Dr. Nash compares argentum nitricum with cuprum metallicum in such cases of epilepsy or convulsions, where he tells that cuprum metallicum has great restlessness between the attacks, whereas argentum nitricum has, you know, the restlessness which is afterwards. So that's all from Homeo Setu right now. If you're following on Instagram, Facebook, YouTube, WhatsApp channel, you will definitely get interesting learning materials very soon. Stay tuned.